After Pastor Sam Adeyemi and Pastor Pedro's discussion, I decided to go online and do more findings about this issue about the pandemic around the world, which happened in 1918 till 1919 December. Okay, so it means from 1918 to 1919 December. That's, I think, approximately 2 years. Okay, so it's called the Spanish flu. Okay, it's called the Spanish flu, and I went online to check figures and analysis and information about this pandemic, and it gets to show that this virus or this flu infected 3 million people. That's 1/3 of the world's population, causing a flu pandemic. Okay, now we'll talk about the flu. It infected 300 million people. Okay, now what was the death rate at that time, the total death toll at that time? Now, when we look at it, it's showing us that at that time it produced the greatest influenza death record in the history of humanity, killing an estimated 675,000 Americans. Okay, and 50 million around the world. This is a very big figure. Okay, now most of you ask, how did this all happen? See, the record even shows that more U.S. soldiers died of this pandemic than even those that died in the battlefield. Okay, this is how dangerous. This is how bad this pandemic or these flus are. So we should be a little bit more careful about it. Now, at that time, if you know, the world is not so advanced when it comes to medical health and all that. So what really happened, that we had a lot of people dying in the US. It was because there was shortage of medical personnel in the US, and doctors and nurses were serving in the World War I. Okay, so there were not even enough staffs or medical personnel to handle the issue in the US. What kind of tools were they even using at that time? Well, at that time there were no vaccines for flus, there were no antiviral drugs, antibiotics, or mechanical ventilators. So treatment tools were basic and limited to supportive care and unproven remedies. Okay, so that's how bad it was at that time. The quick spread of the virus and the limited ways to prevent and treat flu created a major public crisis. Okay, we talk about churches today being shut down, marketplaces, go to self-isolation, limited movements around your cities, around your towns. This has been there for a very long time. This was what they did in 1918. Okay, this was the method they used. So there's not something new about what is happening today. Most of us talk about the world is coming to an end. We're trying to take away the church. We're trying to take away this. No, this is about survival. Okay, this is about humanity. So it has nothing to do with diminishing or extracting a specific kind of sectors or group or religion or whatever else, or culture. Okay, this has to do with survival, because the world right now is really showing you that we don't have the medical personnel, we don't have the technology to handle the present situation on ground. So these are the only methods that can be used to survive at the moment. And when you look at it, 100 years after the 1918 flu pandemic, the world has made major advances in science of flu prevention and control. But at this moment right now, the world has failed on that. So we are going back to the strategy being used in the 1918 and 1919. So if the world was in control, we would not be in the situation we are today. So don't think this is a joke, or don't think this is some kind of a showground for anybody. No, the world has lost control of its own power on Earth. Let's go on and check. The CDC itself is called Center for Disease Control. Okay, it was founded in 1946. Okay, has worked to address the continuing threat of flu, including preparing for flu pandemics. Okay, flu viruses continue to lose one of the world's greatest public health challenges, and the risk of a flu pandemic is always there. It's always there. What it means is, will it happen in the next 5 years? Yes. Will it happen in the next 10 years? Yes. Okay, we should now start considering, will this repeat itself? Yes, it will repeat itself if we are not prepared. Okay, what it means is we should not politicalize our life, our health, okay, our livelihood. And that's the situation the world is into now. Okay, we need to understand that these things will keep coming. It all depends on how ready the world is to handle the situation. The next question I know most people will be asking was, how did they transfer to other nations? Because at that time, let's say the airbound was, or the aeroplanes were different, and the movement was different. It was through ship and all that. Yes, through ship, through goods, through people who move around the world. This is how these viruses got to other places. Did it get to Africa? Yes, it did get to Africa, and I'll read that for you clearly now. Okay, the Spanish influenza pandemic of 1918 to 1990 left an indelible mark on the demographic, social, economic, medical, cultural, psychological, religious, and spiritual character of sub-Saharan Africa for at least one generation in territories as far apart as Nigeria, Kenya, Southwest Africa, and South Africa. Is their memory remained stamped on the names given to each sets and individuals born in 1918 and 1919, and even to those years themselves. Indeed, for the rest of the 20th century, it became a popular means of dating other events as happening before or after the flu. In the somber recollection of one old man in Malawi, 1918 was the year when God was angry. This is how it got to where people were scared that the world would come to an end. And you can look at it from that time till this day unfold. We have gone through different kind of epidemics, talking about Ebola, talking about SARS and all that. So one thing you should know is the damage actually this virus caused to the Americans it shortened their lifespan. And after the virus of 1918, it shortened the Americans' lifespan to 12 years, okay? It deducted 12 years from the lifespan of the Americans. So this has a lot to go through your bloodstream. This has a lot of effect on our lifespan. This is a very serious thing. Most people will ask about, okay, how did it affect? If you go through CDC, that's Center for Disease Control, by yourself, Google it. It's a world center for disease control. You see it. It came to Nigeria, and I think over 226,000 people died of it. Okay, so it's no joke. We have the immune system, but when it comes hard, it kills more. Okay. That is it. But if we're able to control our movements and we're able to be careful and follow all the instructions given to us by our health system, then we'll have a chance to reduce the death rate and the ones infected. So it's a very important message for all of you that you should Google more, study more. There's nothing against the church. There's nothing against the mosque. There's nothing against religion right now. There's nothing against cultural group. And some people do say it's about world power. Somebody wants to take over power around the world. So there's a twist around of everything. There is nothing of that nature at the sticks now, okay? The world is in a great dilemma. The world is in a great problem, which is caused by itself, okay? And right now, because of politics, the world cannot handle its own mess. So for you as individuals who have even less to take care of yourselves, it's better you follow the instructions given to you. Let me tell you, at the moment, money can't save you. You can only save yourself by following all due processes. So I wish you good luck and stay safe.